Here, basically, I said the 280 days we divided by first trimester, second trimester, and third trimester. So, first trimester, when mother came to visit to of doctor office or primary care, you have to tell them to do complete blood count, blood type, or rubella infection scanning, HIV. They need to know the routine urine examination to check the kidneys functioning or not. Then we have to check the vital sign. Sorry, we have to check the electrolyte, blood chemistry, and also any kind of STD, sexual transmitted disease, is called VDRL, Venereal Disease Research Laboratory, shortly called VDRL. If VDRL is positive, we have to go in a particular STD exam. TB test also important, or hepatitis B, okay, or urine culture and sensitivities. Both is important for this time. In the second trimester, if everything is okay, or if anything is positive, we have to correct it, give the treatment, and have to correct. The second trimester, when mother come, we have to check blood glucose tolerant test. Is called GTT, blood glucose tolerant test, because some mother developed the diabetic, is called pregnancy induced diabetes mellitus or gestational diabetic, right? The same time, we have to check alpha fetoprotein, alpha fetoprotein, shortly called AFP. Alpha fetoprotein, if decrease the normal, chance to baby develop the neural tube defect, neural tube defect. So here I said if the alpha fetoprotein is decrease, baby develop Down syndrome. If alpha fetoprotein more than increase than normal, this is defect, detect the neural tube defect, right? If anybody has a neural tube defect, we give them alpha, so give them the folic acid. We give them the folic acid, I said. So in the second trimester, we tell them mother to check the alpha fetoprotein, shortly called AFP. Alpha fetoprotein detect any kind of neural tube defect, any kind of neural tube defect, we said. So the neural tube defect, like this is the neural tube, this is a neural tube or spina bifida. So if the alpha fetoprotein is more than the normal, right, patient has a develop of neural tube defect, or shortly called spina bifida, right? The spinal cord is going down and then extra sac is formed, and this is bifida, right? And more accurately called this type is called myelomeningocele. So this is the vertebra, and this is spinal cord, and spinal cord enter into the sac. So if mother have a defect, and if we give them fortified food or folic acid, they it can prevent by folic acid. Same thing if alpha fetoprotein is down, the chance of baby develop Down syndrome, right? Alpha fetoprotein if down, patient can develop Down syndrome, right? So this is important. The second trimester we has to check alpha fetoprotein. NCLEX board sometimes asks the second trimester which one is most important to check, alpha fetoprotein and glucose tolerance test. Glucose tolerance test indicate mother has diabetic or not, and if mother has a blood sugar level is more than 135 milligram per dl, so they need further follow-up. They need the chance to develop gestational diabetic. And also the second trimester we check alpha fetoprotein. NCLEX board say alpha fetoprotein is increase, indicate what? Indicate neural tube defect or spina bifida. What are the management? We give them to take folic acid during the pregnancy. If alpha fetoprotein is down, baby chance to develop Down syndrome. In the third trimester, right, we have to again do the STD scanning or BTRL test, and also we have to check any kind of staphylococcus infection. If staphylococcus infection is positive, usually the healthcare provider give them penicillin G. Penicillin G, it is the broad spectrum antibiotic. Basically, this is, if we know, it is good.